guys, Dr. Chad here today with another interesting case. Today's case unfortunately is a very severe, difficult cervical case. We'll go through it, but unfortunately in this poor patient, the options are going to be very limited, and I think this is a good example of why getting appropriate imaging early, getting to the appropriate doctor early can keep you from having unnecessary procedures, but in this case can keep this poor patient the ability to walk and use her arms because of the severity of her cervical spine. What we're looking at here is what's called a T2 sagittal image. So this is looking at somebody from the side. This would be the back, the front, the back, the front. This would be the mouth, the tongue. You can see bone, disc, bone, disc. This big gray thing in the middle is the spinal cord. What you want to see in the spinal cord is very similar to what we look at in pipes. You want to see a lot of white because white represents spinal fluid or water. And just like a pipe, you want to see the liquid flowing. If the white goes away, that means things are becoming clogged. And when we say things are clogged in the spine, we describe that as cervical or lumbar or spinal stenosis. And the reason why spinal stenosis is so bad is you have all these nerves that control things in your arm, but the spinal cord, which goes down, controls everything below. Your brain is your computer that talks to everything, so if things are gucked up, if the canal becomes tight, then the signal is no longer able to get to where it needs to go. And when you're talking about spinal stenosis in the neck, you're meaning anything below your neck can be affected. Your arms, your legs, your bowel, your bladder, your sex function. Everything has to get to your brain, so as you get tightness in your neck, that can lead to a host of neurological symptoms. When you look at this MRI, I'd like to start with looking at the bottom. You can clearly see the white in front and behind the spinal cord, showing that the spinal cord has space. As we go up, you can see these dark areas, especially up here, and you can see how the spinal cord is becoming compressed. Look how tight this is. This is a lady that actually clinically was not doing as bad as her imaging. She was having some hand numbness, some hand weakness, but overall doing very well. And this is also another example of how severe pathology doesn't always equal pain. This lady did not have severe pain. Her symptoms are more related to a little bit of numbness, weakness in her hand. When it comes to treatment for something like this, unfortunately, given the severity, many of the things that I offer are no longer on the table. I certainly would not even attempt to do a steroid injection in someone like this neck due to the severity of the spinal stenosis. If anything, I would cause harm because there's no room to inject. Physical therapy, simple things, chiropractor, Pilates, yoga, those things are not going to help someone like this. And it's one of my old lines. I always say I'm a neurologist before I'm a pain doctor. And what I mean by that is when you're dealing with something that has the potential for severe neurologic compromise, your pain is the least of your problems. And in this situation, that's exactly what's going on. Regardless if she has pain or not, that's the least of her problems. She has to get this fixed. I referred her out to a neurosurgeon. What she's likely going to be looking at is removal of all these dark areas here, which are grown ligaments, discs that have herniated, some grown ligaments here. She's probably going to have hardware introduced at multiple segments with artificial disc and likely plates. But long story short, this entire area needs to be decompressed for her to maintain appropriate neurological function. It wasn't the news she wanted to hear, but at the same time, at least she understood what was going on, at least she was made aware of it, and at least we can get her in the proper course and treatment. I did not waste her time talking about medications, therapy, injections, because again, it's critical that she gets this cervical spine fixed. So I hope this was helpful. If you have any cervical issues or complaints, numbness, weakness, as always, please come sit down with me. I'll look at imaging, order imaging if not done, and try to get you on the correct course. Even in this situation where I was not able to help her, but the help I was able to give her was to put her in front of the right people and to keep unnecessary treatment and time being wasted on a very serious neurological problem. So I hope this is helpful. As always, we'll keep these series going. If any questions, comments, please interact with me on social media, and look forward to seeing you guys soon. Take care. Bye.